Good afternoon, everyone. It is April the 29th, 2021. I'm Matthew Holt, the founder and publisher of THCB, and it's time for another THCB gang. We're going to have a lot of fun today. Our guest lineup, we have some regulars and a special guest who's on the show today, Michael Millenson from Health Quality Advisors, a guy who reminds us he wrote a book more than nearly 25 years ago, which is kind of relevant given who the guest is today. Then luckily, for my female guest to return, I was feeling a bit like the guy in high school who kept on being told that they were going to come and then never got the date because I've been struggling to get to recruiting recently. But Jen Benz from Siegel Benz is on with us, employment expert. Lygeia Ricciardi, formerly consumer person at ONC and these days Chief Transformation Officer at Carium. And my partner in crime at Health 2.0, Jessica DaMassa, editor and queen at WTF Health, is on me. And our special guest, you'll meet in a minute, is Shantanu Nundy. I just pronounced his name wrong, haven't got it right earlier. We had a conversation about that. Who is the Chief Medical Officer of Accolade, the navigation company, publicly traded. And more importantly, for our terms, the author of Care After COVID, a book which I think is coming out next week. So with that, we're going to go put everyone up on the screen. And welcome to you all. We're going to kick off just the same way as ever is, what the hell have we seen in the last week or two that's interesting to us? And I'm going to start with you, Michael.
Well, I'll let others talk about COVID spreading or not spreading a vaccination. What I want to mention is last night's speech by President Biden, which if you close your eyes and click your heels, we controlled drug costs. We gave everybody affordable health insurance. We rebuilt our public health infrastructure. And I believe we lived happily ever after. So that was just a wonderful speech, because I know that most of those proposals will probably be passed unanimously. What was interesting, by the way, was what was not mentioned. When people say our healthcare system is not rational, they're not right. Our healthcare system is built on giving everybody everything they want and make them think it's for free. And so we did not mention anything about quality or value-based purchasing or safety or patient-centered care or anything that would do anything other than we have wonderful providers, just give everybody access to them and control the evil drug companies, and we'll all live happily ever after. So I was really thrilled with the speech and was, look for Tinkerbell to appear right afterwards, but instead got the Republicans. But, what are you going to do?
All right. Jen, what have you been looking at the last couple of weeks?
I don't know how to follow that up. So the things that have been top of mind the last couple of weeks, we're talking to all sorts of clients, and people are super duper stressed out and not accessing mental health benefits that they need, not using all of these resources and programs that have been put in place for the last year to help them get it through. And people are just generally burned out and kind of on the edge of a total breakdown, it kind of sounds like. My team included, I think at times. So I think it's an interesting conversation right now when we clearly have so many people that need a lot of support around mental health. Why aren't they actually using any of that stuff? And how do we get them to do it? And why don't we have providers available? And it's all kind of a mess right now. So that's what my last week has been all about. All
right. Well, interesting stuff. Shantanu, we'll come to you now. Give us your quick over the last couple of weeks. We'll come back to you about the book and everything else and introduce you probably, but just come off mute and tell us what you've been seeing the last couple of weeks and what you've been paying attention to.
Yeah, I mean, I think as you guys may know, I think our world at Accolade's been pretty excitedly consumed with the announcement for our intent to acquire Plushcare, which is a virtual primary care company. And so, yeah, just gearing up for that, getting lots of great customer feedback on that announcement, getting feedback from our own teams, talking to the team at Plushcare. So it's just been a lot of excitement around that news.
Very exciting. I may have a comment on that in a second, but Jessica.
I knew you were gonna come to me next. So from Fantasyland, where that Biden speech was written, a remote corner, a little island called Health Tech Land, where billions of dollars are pouring into companies. I'm wondering who's left to give $100 million round to. I don't even know. There's maybe like 6 startups that are left. $2 billion. Okay, great. put yourself on the list. Yeah, $2 billion in funding, I think just last week alone. And then we're watching, in addition to all of the money pour in, the valuations are just sky high. I'm seeing the Accolade acquisition of Plushcare be demonstrative of a new trend in which every company seems to be becoming a virtual primary care company that also provides some sort of healthcare navigation with a robust telehealth component wrapped around it, and also a mental health capability. And they're collecting data that they're using their proprietary AI algorithm to find and make sure that patients are receiving the right care at the right time in the right place. Everybody's becoming this, and I don't know what's going to happen, because I don't understand how we went from let's unbundle traditional healthcare to let's digitize it. Now let's rebundle it back up. So I'm looking forward to talking about the book, and I want to hear about what's going to happen next, because from this little piece of fantasy land over here, yeah, I'm just waiting. I think everybody's waiting for this bubble to burst.
I can't believe you got through the whole thing, didn't mention the blockchain.
I was going to say well, actually, that's what's going to happen next, is that everybody's going to wrap a benefit around it. So they're all becoming little micro health plans. And I'm sure that those transactions will be facilitated via the blockchain.
On all paid for with doggy
I think
coin.
if you've been keeping score and you have your bingo card out, I hit them all.
Wait, you didn't, Jessica, you didn't say I could pay my doctor with Bitcoin.
Oh, yeah.
Doggy coin, Dogecoin, doggy coin, whatever it's called.
Oh my God, we're going to skip over.
Right, Lygeia, I'm going to put you, I give you the awful job of going last here.
All right, so somebody has to talk about COVID, and it's going to be me. And I'm going to highlight, first of all, the positive, which is personally, I'm getting close to having my 2 weeks after my second shot. So I'm just like, that is a great feeling. A lot of my family is vaccinated. And also, as I'm sure you guys know, 43% of the American population has had one shot, and 30% is fully vaccinated. So I should say 43% has had at least one shot. So that's the sort of cap amount. But thank goodness, we're really starting to make a dent. That all being said, of course, it's not all sort of wonderful. Excellent. Look at that. It must be a fresh one. Shot 2. All right, good deal. So issues include, so great that we've got the vaccine in terms of volume, but the vaccine hesitancy problem and issues with distribution are a concern. I'm also concerned about kids and the spike in cases in kids, particularly since I have 2 at home. And it is tempting when you have adults who are vaccinated to take your kids and be like, oh, we'll be good. But, I'm a little concerned about what's going on out there with that. So yeah, huge progress. And I do want us to sort of step back and feel good about that, because there's an awful lot to stress about. And that is a real thing, not just a fantasy thing. So thank goodness. And we have a long way to go.
Fantastic. Excellent. All right. Well, let me introduce Shantanu a little bit more. So he is as you mentioned, the Chief Medical Officer of Accolade, and its last couple of weeks have been consumed with the acquisition of Plushcare. Accolade is a navigation company. But other than that, you've done a lot in healthcare, Shantanu, and you wrote this very good book, which I consumed last night, called Care After COVID, which is really, we were kind of kidding before we came on. This book has just come out, but we were kidding before we came on, because we spent a lot of time on THCB Gang talking about COVID and what the impact of COVID is in vaccinations. And last week we had an entire thing about passports. And poor Devin McGraw, who was our token lawyer, found that she was being asked badgered all these questions about lawsuits and who's going to sue who and when we're going to be able to enforce passports and all this sort of stuff. And we spent a lot of time talking about, is anything going to change because of what COVID did to the standard healthcare system? So your book is actually basically about both of those two things, but more the latter. If I was to describe it, I would say it's done in an interesting way, because you go through a bunch of different topics that kind of came out of your experience being a primary care doc amongst the underserved, both in Chicago and in DC and elsewhere. And it also came out of your experience of building digital tools to help improve doctors' knowledge. There's a bunch of stuff going on there, so I want to dive into that a bit. But it also is, what have you experienced at Accolade and with some of the companies that, Jess jokingly calls I won't go through the whole spiel, but the virtual primary care navigators that are being developed by digital health with this money. So, and And I think what you're suggesting is that you're kind of optimistic. You think that relatively soon we're going to get to this place where patients are properly managed over the continuum of care, where they're able to deal with different modalities, whether they need an assistance or don't to do telehealth, or they want to come in when they want to come in, and that we're going to figure all this out. Is that a fair estimation of what you wrote?
Yeah, that was pretty good. I was taking a couple notes there. Yeah, I mean, I think the main point is really that we're in this catalytic moment, right? I think most people, acknowledge we're in a once in 100-year pandemic. I actually think we're in a once in a century opportunity to reinvent healthcare. And I look at it both normatively and positively, like in the sense that, look, I think things are better. We can talk about what things are better and how things change. But I also look at it as a shared obligation we have to take this moment and move the system forward. And so it's both something that's happening as well as something that we ourselves have to deliberately shape.
What do you think the one thing that you didn't do, and maybe I just read the book so fast, you have a lot of advice in the book. In fact, every chapter ends with a fucking D1. It ends up with kind of, if you are this person, you should do you are in this group, here's what you should do if you are an investor or a hospital or whatever. There's a lot of sort of things to think about. Yeah. You don't exactly come out and say who you think is going to own and control the healthcare system at the end of this. You have a lot of things that we should do, and I want to dig into a bit of these in terms of especially spreading medical knowledge. The fact that you felt that you didn't know enough when you're practicing medicine, and that you went off and did this whole thing where you try to build a sort of a knowledge system for all doctors. A lot of questions about which different team members could communicate with people. There's a great story about somebody who's about to commit suicide, who gets in a text message conversation with a coach, actually at Accolade. I mean, lots of great sort of into how it might happen, how things could be better. I don't really get from the book who you think is going to run the show. And to go back to Jess's sort of question and comment about everyone becoming a virtual primary care navigator, we still have really large health plan payers, really large hospital provider institutions doing all types of different things, but in general doing kind of what they were doing when Michael wrote his book 5 years ago, called Demanding Medical Excellence, right?
24 years ago, yeah.
Not that you're counting.
but in reality, I've had people read it more recently and say nothing much has changed. And can I just jump in? I want to ask you about who's running at Shantanu, because one of the things, I wrote a piece for the BMJ a few years ago called Collaborative Health, and I called for shared information, shared engagement, and shared accountability all across. And it occurred to me that folks like Accolade, we talk about interoperability, but is your information available if I switch employers, right? And they don't offer Accolade, what happens to my information? If I want your information to go to a different doctor, if I want you to have information that I took off of patients like me, I mean, I don't see interoperability where the patient can really be the center, despite rhetoric about that. What does that kind of interoperability mean for Accolade?
Yeah, that's a great question. I don't know where you want me to jump in, but I'm happy to start there. Oh, go ahead, Matt.
Answer that one, and then answer that one, and then we'll come back to the big picture about who's to run the show, because there's sort of data. Sure. There's data, and then there's sort of control and employment, and where the front.
I mean, look, on the control point, right? Ultimately, where we need to go is the patients and their families are in control, right? There's no question about that, and I think that. And I think that, but I do recognize that one of the threats, so as I go around with this very optimistic message, one of the threats is that, yes, there is greater and greater consolidation happening, both brick and mortar and to your point, Jessica, in the virtual space. And I think, and of course, payers and I think that is one of the largest looming threats to, I think, the future that I think all of us here on some level would agree we need to get to. And so I think that needs to be explicitly dealt with in order for us to clear the way to that future. I think, Michael, your specific question, I mean, I think, as you know, one of the limitations of employer-sponsored anything is the fact that it's sponsored by the employer. And that means that when you're not with that employer, that thing goes away, regardless of what that thing is. And you're right, Accolade is one of those things. One of the things I'm excited about Plushcare, as to bring that conversation in, is the fact that today they are a direct-to-consumer company. And so it's not near term, but we do contemplate a world where people will be able to take the Accolade service with us. What's interesting is that we've had members ask us that, like, hey, I'm about to retire, or hey, I'm switching jobs. Can I bring Jenny with me? And so we know that people are interested in that, but we haven't yet enabled that. But I'd certainly love for us over time to be able to do that.
So one thing, Jen, let me go in.
That desire exists in a lot of benefits, because we've talked about before that we have kind of the haves and the have-nots. Like if you work for a high-tech company where you have all these fertility benefits and all these concierge benefits and all sorts of niche programs that support every aspect of your life, and then you go work for a city or a county, you're going to have a totally different set of options. So that desire of taking these really high quality programs with people is we see that in all sorts of aspects of employee benefits.
Let me dive in a bit, and I want to grab Lygeia in here because of her illustrious past. I get if I was to say one impression that from your experience of writing them, not writing the book, but your career describing the book, Shantanu, is that healthcare is just crap at customer service. And when you got to Accolade, you were surprised about they actually cared about customer service and staying on, then even to the point where their nurses will call into an appointment. And I think over the time, Health Group and I had 2 or 3 companies come and show where they were trying to get a family member or get a record of the appointment, and it never really went anywhere. We know what happens at an appointment. It's a complete mess. I mean, Michael's been writing about this for years. So let me ask Lygeia, and then come back to you. Perhaps you guys can come back and talk about this. Lygeia, what did you expect that we would be at by now with the consumer experience in healthcare, given this was something that you were quite a few years ago in charge of, at least on the data side? You're on mute, so can you unmute?
There's the famous line that, and it's been attributed to various people, I think, including Bill Gates, that people usually overestimate what we can do in a year and underestimate what we can do in 10 years. And the short—
I have to interrupt. That is not Bill Gates' line. It's Ian Morrison would shoot you if he was on, because it's from Roy Mara, Institute for the Future. He made that up. Anyway,
fair enough.
But you're right. It's a good concept.
Attributed, but well, good enough. More people should say it. Let's leave it there. It's true that in terms of sort of patient empowerment, engagement, all those kinds of things in the shorter term, I wish we were further. It's been discouraging to see how slow it is to get patients access to their own health data, for instance. Although in the big sweep of things, I feel like hopefully we're moving still in that direction. It still has been sort of painfully slow. And I don't know. I mean, we're getting there, but bit by bit by bit, I wish we were further along. And I am not sure. I mean, I don't have the answer. I would love to know the answer to sort of the question Jess was asking and others, like who's going to own this and where's it going to move? And how do we do this in a way that really does empower patients? There are things that I like about employer-sponsored care, but honestly, if I could, I probably would eliminate it entirely in favor of something that's more, government-centered, so that you don't have the problem of portability of care and of data, honestly.
So, Shona, this is where you say, no, it's much better that Accolade does this.
I'm not going to go there. I mean, I think, where I usually start, is the core patient experience, right? I mean, even the whole conversation in the country is about financing, right? I mean, that's what Medicare for All or whatever it is. It's a financing conversation. And I think the way I look at it, if you have Medicare, you don't have Medicare, you're uninsured, you're commercial insured, healthcare sucks. And it sucks from the moment you have the health need. So on Saturday, my 7-year-old, you talk about kids, I have a 7 and a 5-year-old. My 7-year-old has a chronic condition, but she's never had shortness of breath before. She's got a different condition. And on Saturday night, just out of the blue, she became short of breath. And it was like 7 o'clock at night on a Saturday. My wife and I are both physicians. We're sitting here looking at our daughter, now turning on our clinician radar and watching her cough like every 20 seconds for almost 2 hours. And, we tried all the little things, the Vicks steamer, and I took her outside and held her in my lap, and we tried her cough drop, and she kept getting short of breath. And we started getting more and more and more worried, right? Those are the moments in which healthcare fails us. those are the moments where healthcare fails us. And we were lucky enough, we called her pediatrician. She's got a great pediatrician. And the first thing they said on the answering line, it said, the first thing you should do is if it's an emergency, call 911. The second thing it said is you should call your health plan. And the third thing it said is for $25, you can leave a voicemail and someone should call you back.
Yeah, that's not cool.
And then
call the health plan. I'd be like, and I'm done right now with this.
Yeah. And then
let me dial up my teledoc and pay my.
And then we messaged my sister-in-law, who happens to be a pediatrician. We ended up, I don't know if I should say this publicly, we ended up calling in a prescription for a family member. Let's just leave it at that. And then I started navigating. So I had to find a 24/7 firm. This is only 7 o'clock at night on Saturday, by the way. And I'm like trying to find, and so it says 24-hour CVS, but actually it's a 24-hour grocery store, but the pharmacy's closed. So I have to call like 6 of these places until I find one. I drive it, right? You get the pick.
Been there, lived it.
Yeah, we've all been there, guys. And so regardless of, okay, patients have their data, absolutely. Employer-sponsored plan, who knows? Medicare for all, great, let's get everyone covered. I'm focused on that problem.
Right.
That problem that I had at 7 o'clock at night on a Saturday with my daughter who couldn't breathe.
This goes back to, I think, that bigger question that we were just talking about, as a group. It's like, this whole idea of, it's like your care is with your employer, and if you leave your job, can you take it with you? But what we've seen, I think, this year, especially on like the health tech side and on like the new entrants into the market, from like a health tech perspective, is a lot of companies that are going direct to consumer. And they're getting a lot of funding. They're raising a lot of money. You've got HIMSS. You've got like a couple of these that provide those services. And they're banking on the fact that maybe it's not the older market, but the millennial market wants their care on demand, like they have everything else on demand. And so they're placing their bets there. At the same time, you have a lot of those non-traditional healthcare players, the retailers. Like, I mean, you had just mentioned CVS. You expect that to be open 24 hours, right? I mean, what's Amazon with their Amazon Cares feature now, and PillPack that they've had for years. Walmart, the 24-hour capability there. And you're seeing them with their Walmart care centers. It's like, how much of this ends up moving the market as a whole because of the fact that we've got these different entrants that are coming in that are willing to cater, not necessarily to the patient, but to the consumer, the healthcare consumer, right? What do you think about that?
Yeah, I mean, look, I think one of my optimisms is we're finally in this wave of the digital health revolution, finally reaching scale. And the reason scale matters, I mean, of course, it's the dollars and the lives and the revenue and all that public, all that fun stuff. But the reason is because it's about power, and it's about, I've been building apps and widgets. That was how digital health worked. It was a layer in a stack. And now we're just taking whole stacks, right? And I think, and getting real scale with that. And I think it is going to, it's getting attention, and it will eventually.
How much of that, you started out by saying, I think we have this moment right now. How
Absolutely.
Much of this is part of that moment? And the piece of that too is that, how does is this moment drawing to a close at this point as COVID comes to a close?
Yeah, no, that's such an important question. And I think I definitely want to take a minute on that. I mean, I think that you're right. We have a window, right? We have a window where every single day above the fold, New York Times, Washington Post, where we're talking about health, where when I walk into, an employer prospect now, they're asking me about health equity. That's like one of the first things coming out of their mouths. And they're talking about, like Jennifer did, mental health. And so we absolutely have a moment where the attention of the country, and there's this lived experience. Like most patients with chronic diseases or rare diseases, they've had a lived experience that other people frankly didn't empathize with. We all have a shared lived experience. Everyone has had the experience this year of trying to get a test and not finding one. Every person has had an experience of trying to get a vaccine and trying to figure out a Byzantine scheduling system. We've all been through that. What so many of our marginalized patients or our complex or sick patients have had to deal with. And that creates a true groundswell, I think, of interest and demand, saying there's got to be something better. And at the same time, the other part that's really critical, and I'll talk about my safety net clinic, because to me, like if you see change there, that means change is real, right? We moved from 0% to 80% virtual in 2 weeks, right? Like from, oh, this will never happen, this is complicated. So I walk in one day to clinic, and it was just the surreal experience where, how like you get those nightmares where you're like, you show up to school in your underwear. Like I showed up to clinic on a Friday, and I thought I like was either dreaming or I was like in I came in on a Saturday because the waiting room was an empty, like a ghost town. And I work at a free clinic that's just jam packed with patients. And I walk in, I'm like, what is happening? I go to the workroom and someone hands me my clinic iPhone. And they're like, guess what? All your visits are virtual now, right? But it's not just that. People talk a lot about virtualization. We moved testing to drive-thrus. That's a big freaking deal. For decades, we've been taking sick people who are coughing and sneezing, putting them in a place we actually call a waiting room so they can cough and sneeze on each other just to see me for 5 minutes just to get a test. So we've moved that to that. The other thing we've done is we're using data. So when the vaccine was being rolled out, we actually used our EHR data. We downloaded it to figure out who was sickest and needed the vaccine most. And guess what we did? We actually started cold calling them. And then we started sending people to so those are massive shifts at scale. These aren't pilots that happen. And it's done a number of things. I think it's thrown out old assumptions. Like I doubt forever onward that we will not have a drive-through testing facility during flu season. But the other thing it does is it actually has built a muscle. This is something that I've been talking to a lot of people about is we've actually created, I'm calling it medicine's greatest generation. Because you now have a generation of doctors, nurses, pharmacists, administrators who actually practice public health in medicine. You know what I'm saying? Like we're actually using data, like looking at local epidemiology, acting on that. We are building new protocols overnight, deploying them, and then fixing the hell out of them. We're like, you know what I'm saying? Like we're leading and changing and adapting. And that muscle that we've built, like the greatest generation after World War II, I think that muscle will sustain itself. And now my thought is, hey, let's turn that to obesity. Let's turn that to HIV prevention. Let's turn that to diabetes. And so the potential is there, the demand is there. But like most things in America, people are going to turn the chapter on this really fast. And so we have this window, I don't know how long it is to your question, maybe it's 18 months, maybe it's 2 years, where we have a moment to say, we're going to go a different way now. That's sort of the message.
So Shantanu, I sort of want to agree with you in the broader scope and maybe disagree in a couple of places. And by the way, I think you're misinterpreting when you go in and everybody's talking about health equity. I believe they want founders shares in Accolade. I think you're misinterpreting that. I believe they said green lives matter. I'm not sure, but that might be what they're talking about. So let's talk about power. Okay, let's talk about power. When you give people access to care, right? That's what what is the public thing? We talk about patients and consumers. What we know is that people don't want to think about their health unless they're sick, right? And so part of the reason the patient empowerment thing and direct to consumer doesn't work is that most people don't want to think about it. And you have the wellness people and you have some of the others, but they really don't. And I heard the other day on a Med City Invest where an entrepreneur was talking about, you get into this for one reason and then to make money, your business plan is selling your product to whom? The establishment, the employers, the hospitals, the others. So when hospitals talk about being patient-centered, they mean it the way Chase Bank means about being customer-centered. How can we keep our customers closer to us? It's about maintaining power. Okay. And because the consumer doesn't have the money and won't spend the money, the people, the golden rule, they were the gold rule. And so what the customer cares about as the voter is give me as much as I can, as free as I can, as the employee. But in general, they don't think about health. And if you're trying to sell different products, now, whether what Lygeia said, it works if it was a single payer system, sort of, because when you go to the rest of the world, even if you go to something like Israel, which has sort of the managed competition, as if Hillary Clinton suddenly became prime minister of Israel and they adopted it, right? But even if you go to other places like that, what you end up is the same power issue. And Shantanu, I couldn't agree with you more about changing the delivery system, which is what you're trying to do. But it turns out, and for me, this was a revelation as I learned about this, all doctors are trained pretty much in the same way, right? The Western medicine. And whether you go to China or Italy or Israel or America, that kind of doctor-patient relationship, we know the science, even though we haven't read a medical journal for 6 years. And, you have to do what we do, and we can't disclose errors because you're going to sue us and you'll lose confidence in us. All of that is the same, pretty much cross cultures. And I spoke to a couple of long COVID. This goes to generations, right? When you say generational moment, well, maybe you should go to Mississippi and Alabama and see whether the millennials are changing there. I talked to a couple of women who are long COVID patients. And both of them belong to very progressive healthcare organizations, one in the Northwest, one in Minnesota, and their doctors wouldn't listen to them. And they were women doctors. And I said, were the women doctors better than the men doctors? They said, well, yes, they were much nicer when they didn't listen to us. And so there's these strong cultural elements. And I think you're right that we have a once in a generation opportunity. It's a wonderful opportunity. And I think the millennials will help. But what is changing things is that digital health is making information transparent, right? It's kind of what the Pew people said years ago with Susanna Fox. And so when we are no longer able, doctors are no longer able to hide professional information, and you have the employers and you have others, it may not empower the individual patient, but it does break up the monopoly on power. So I couldn't agree with you more that things are changing, but you have to be sort of realistic about individual power versus institutional power, and frankly, generational power. If you go out into different parts of the country and some different places, it's like the baby boomers said everybody was protesting against the Vietnam War. Well, everybody they knew in college was, right? So, I'm just having a little bit of caution, but I think what you're doing is terrific. I'm just a little bit more cautious about how transformation will be, how soon, even if it's Ian Morrison who said it and not Bill Gates or Yogi Berra.
Roy Amara, we got it right. Anyway, Shannon, you want to respond to that, or there's another part of your book I want to move you on to around care treatment. But
yeah, let's move on. No.
Well, so when they make the movie of Care After COVID, and you're sitting there on Oscars night, right? The star of the movie is a young woman in Mozambique called Ashanti, no question in your book, right? So I want you to explain what Ashanti does, what her job is, and how she gets to do it, and why the hell you can get it in Mozambique and not here. So could you just...
Yeah, no, thank you for that. And it's really cool to see that story resonating more than any other. They just couldn't be more excited about that. So when I was at the World Bank before Accolade, working in developing countries all around the world, had the chance to go to Mozambique post another very different type of disaster. And it was a cyclone. I don't know if you guys remember, but a few years ago, there was a major cyclone that hit Mozambique, and actually 2 cyclones in a month. And in the post-cyclone state, we went out there to do an assessment of their community health worker program, which is this idea of taking people in villages with usually an 8th grade education, training them for a little bit, giving them a backpack of medical goods and saying, you're responsible for the health of your village, basically. And what was amazing, and I thought about a lot during COVID, is you had this massive catastrophe. I mean, hundreds of thousands of people displaced, thousands of people died. And yet the entire healthcare system that they had was intact through that. And yet what happened in this country was that, it shut down the entire healthcare system, not just around COVID, but we know preventive care and primary care and all those things plummeted around that time. And so that was the fascinating analogy for me. And really out of that emerged the 3, themes that I talk about in the book. So the first is that care is distributed there, meaning that care is closer, care happens where health happens, which is at home and in the community. And so these community health workers, because each of them is displaced all around the country in different villages, the fact that the major city hospital was flooded, that didn't affect them. It's like the analogy, right? Like, don't put all your eggs in one basket. So their eggs were all over the place. And so, the eggs didn't break, or maybe one did, but the rest could sort of continue on. The second was that they were digitally enabled. So Ashanti walked around with a cell phone that basically, because she had an 8th grade education, would help her know which households to go to each day. That would, if they encountered a child under 5 with fever, would actually take her through a protocol to ask all the right questions to figure out what they had. And then the last part was decentralized. She had not just the responsibility for a village, which is very analogous to value-based care. Value-based care is like, hey, Shantanu, guess what? You as a primary care doctor now have the financial risk of your patients. And you're like, what? But decentralized means you do that, plus you give them authority and you give them resources. So in her backpack, she had more medical equipment than I have in my clinic, because she had a pulse oximeter, she had what's called a rapid diagnostic test, an RDT test for malaria, and she had anti-malarials. Like, I don't have medications in my clinic. And so by decentralizing that authority to her, what that meant is that she was able to be much more responsive to the needs that they had at the time. And so it was just an amazing story, because I think I saw there, in one of the poorest countries, by the way, in the world, a system of care that, to me, was far more advanced than the one we have here.
So I guess the next question is how does that happen here? And then I want to come to Jen on what is the role of employers and benefits, both you and Shantanu in the world of employer benefits, and some of that delivery system. How does that work? Or where does this come from? Public health, like the folks who've been setting up the drive-through vaccinations? Or where does that come from, and who's got an incentive to move that kind of system to here? Because we don't even do what the Brits do. If we go back to when my mum had a baby in 1977, and I was old enough to know what was going on because I had a much younger sister, the district nurse showed up twice a week to make sure the baby was okay. There's that level of stuff. How do we get that? I mean, is there a way we can get that kind of empowered community health worker here? Because you'd assume that this is the moment to think about exactly that, right?
Yeah, I mean, I think the first part is, it's a great, I think the first part is, part of what I'm trying to do with this book is present a framework, right? Like, yes, there it might be community health workers in inner city DC where I practice, it might be community health workers. Elsewhere, it might be virtual care. Elsewhere, it might be home care. Elsewhere, it might be, right? That's why I'm saying it's distributed. It's closer to where you are, right? And how actually you implement that, I think, has to be specific to the population that you're trying to serve, right? And there's a lot of components to it. I think part of it is just leadership. Like, I gave the example of the drive-through testing. There's no regulation, no incentive change needed for us to do drive-through testing. Why haven't we done it for 3 decades? There's no regulation. It's still fee for service. The technology was there. We just didn't do it. So I think sometimes what happens in healthcare is we let sort of regulation or misaligned incentives be an excuse for just treating people in a really shitty way and not really doing anything different or new, right? Like, I'm not saying it's not important. It is important. And the other thing is change creates change. So part of what's happened, the other shift that's happened during the pandemic, which a lot of people talk about, is people have come to trust care outside of a clinic and a hospital, right? People like Michael have been saying for decades now that, hospitals are not safe, and nosocomial transmission and ICU delirium and all these things. But generally, if you ask most patients, and actually most doctors, they tell you like that care, like that hospitals and clinics are like the best places to get care. And that if you get care virtually, get care at home, it's like somehow worse. And I think because we've all had the lived experience of having done this at scale, I think one of the biggest shifts that won't go away is that we actually, people say medicine moves at the speed of trust. We as doctors, we as patients have learned to trust care outside of a clinic, right? The notion that I could go to a football stadium to get vaccinated, right? The notion that, right, I could go to a McDonald's type drive-through and get tested. Those were not things that we were ready to accept. And I think we are now, and that culture shift, regardless of policy shift, will not reverse itself that fast.
You need to just wait for medical malpractice to catch up with this.
All right, so I understand.
It's one lawsuit.
I understand you're not the only person who's been to East Africa. Lygeia, do you want to chime in?
Yeah, I actually lived in East Africa for about a year, and I will say I did not see optimal models of care that I wanted to emulate, and I basically did everything I could not to need care in any way. Nevertheless, there was a great deal of creativity. I was in Eritrea in East Africa. People were doing open heart surgery on sort of locally. They were working with what they had in a wonderful way. We obviously have an entirely different level of resources, but what I wanted to say, sort of as a comment for how this all translates into the US, based on work that I've done with Carium, it seems to me that it's not just a matter of like, well, should care be in the hospital or should it be at the Minute Clinic or somewhere else? But what we really want to look at is team-based care. And whether you're talking about a team that's all institutionalized together, or maybe they're spread across different organizations, you want an array of different skill sets to help manage people. You want that frontline worker who's able to just kind of carry on. Like there's actually a nurse, a visiting nurse who I sometimes call in here on Capitol Hill in Washington, DC, who will do stuff like strep tests and other things that are sort of like, I'm pretty sure my kid has something, but I don't even want to, maybe the Minute Clinic isn't even open. So I'll use her for stuff like that. And then there are things, if she's like, oh, I think this bone is broken, obviously we have to like escalate and go somewhere else. And my experience at Carium is that we're able to sort of do this virtually. So you've got the coach who's interacting with the patient on a more or less daily basis, looking at their data, doing this pop health analysis and saying who needs an intervention. But then if something gets complicated, boom, bring in the surgeon who did the surgery and let's sort of hash it out. So I think sort of doing it virtually and connecting people into virtual care teams is critical.
Totally agree. Totally agree. And that's why, again, I prefer the word distributed, because the other thing I say about virtual, people are like, oh, care got virtualized. Well, did it? People still have to stick a Q-tip in their nose to test themselves. People have to still go pick up a medication. People have to still swallow that medication. So yes, the visit got virtualized, but you have to think about the episode, and that became more distributed. And I think it's a little bit of a sort of a misnomer to say, well, care became virtualized. Like, I don't know if that's true. And Jessica, something I wanted to bring up sort of on virtual sort of, is, people love that analogy, right? Of like, oh, it's like banking. It's like banking, right? Like, because, before you used to go to a bank, then you went to an ATM, which is maybe the drive-through test. And then now you can bank at home. And look, the magic of technologies, you could do certain things like deposit a check that you can never imagine before. But the thing that I sort of say on the other side of that analogy, though, is what most people experience, particularly when they use a standalone telemedicine company over the pandemic, was that it's like going to a bank. And when you put in your information and you're about to like withdraw money, it first asks you, how much money do you have in your bank account? Right? That's what the experience was, because you call your generic telemedicine provider and they have zero health information about you. So they're asking you for your health information before they care for you. The other analogy I was giving people.
Did not know what happened to you? Call your health plan first.
Yeah.
Yeah.
Though.
How much money do you have in your bank account? What kind of insurance do you have?
Yeah, totally. Totally.
If you didn't have your info and you weren't able to basically press a button on your app or whatever and say, share with this doctor.
Right. And that's my point. And then the other analogy I give is, imagine if you were depositing money in your bank account and you deposit it into an ATM. And the next thing I said is, thank you so much for that. Can you please send a fax to your bank letting them know that you deposited $100? And so the reason I bring that up is because I think you made a really great point earlier, is that one of the things I'm concerned about with what's happening with the consolidation of virtual is the notion that we're replicating the walled garden of brick and mortar and replicating that within virtual. And I think for at least Accolade, I can say, is that we're taking, even though what it looks like to the outside is, oh, we're doing something similar as what these other organizations do, the strategy is completely different. The strategy is one that is not trying to build a walled garden. It's trying to explicitly say that this has to be part of the overall, care ecosystem that you're a part of, for that exact reason, which is that you can't just show up and not have any of that information be connected. And so I think the how ultimately is going to matter a lot more than the what, but I am concerned that we're just recreating Partners Healthcare like virtually.
Oh, I've said that before. I said that before. I feel like it's like, how is this really any different than what we already have? Because only now it's maybe got like, I don't know, some stuff.
Now it's on demand, but it's still on demand, bad fragmented care.
Right, exactly. And it's like, and I get what you're doing at Accolade. I've interviewed your CEO when you guys went public. And it's like, I get what you're doing. And I think for me, like, and this is my question, not only to you guys, but to anybody in this space, it's like, how do you not end up being in a walled garden when the system around you is a walled garden? It's like you might be like a little bullseye in a target that just keeps like expanding outward. And so you might be able to break down your walls to the next ring out, to the next ring out. But ultimately you're going to hit Partners, Kaiser, United Healthcare. I mean, like, pick an incumbent organization, a pharma company, you're going to end up hitting those in the way that they work. And just the volume of care they deliver, the number of people they see, the amount of information they have. Mm-hmm. It's like, how do you come up against that?
And
I can't. You're right.
Can we go to Jen? Because she has a comment on that. And some.
Please.
I was going to say, and more information or more access for the patient isn't solving that problem of how do you actually navigate through all of those complicated systems and get to the right outcome. And I see that all of the time in my own personal experience because I had cancer when I was 19. So I have this outrageous amount of follow-up care that needs to be coordinated, and getting the right information to different providers and so forth is just a mess. But there's so much of this, of the last 20 years or so of healthcare that has been about empowering the patient and about making the patient a consumer. And one of the things that I liked about Accolade from the very beginning of when they launched was really this acknowledgement. And I think this is where a lot has shifted in the last couple of years, or the last year or two, that it's not about the patient being able to be a good consumer. There has to be some level of expert guidance for them to get to the right outcomes, because the system itself is by its nature going to take advantage of the individual patient. So how do you kind of wall off that aspect of the system and get someone who can guide an individual patient through?
Jen, you said the system by its nature, a for-profit system by its nature, right? And so we talk about innovation, but why? Remember when the internet started, we were all going to be fifth graders talking to experts all the time or whatever, right? Everything was going to be free. Maybe not.
Yeah, no, I couldn't agree more. And I think particularly for our most vulnerable patients, it's overwhelming to try to be your own advocate or to be a consumer. But I think to us, I mean, the focus that I have, and I think this partially gets to Jessica's concern, and I think specifically to yours, is take what I'm trying to do in mental health, right? When I got to Accolade and I was new to employer health, and this was pre-pandemic, I was like, wow, I love how mental health is baked into how we provide our service. We have behavioral health, specialists and navigators, but I wanted to do more. And so I said, great, we have this partnership program. Let's go find a partner that delivers collaborative care being a model of doing integrated physical and mental health that's been around for 30 years, tons of randomized control studies, massive ROI. And when I went to market, and there's a lot of mental health companies, as Jessica knows, I couldn't believe nobody was actually providing that service. All of them basically were providing some version of, hey, we have therapists and we have psychiatrists, and our therapists will see you within less than a day, and you can have this many visits with them, and isn't that great? And I said, that is great, because that is part of the problem, is that there's not enough supply and people have to wait a very long time. But I was more interested in outcomes. I said, how is that going to get outcomes? And to sort of Jessica's point, like, okay, you can see a therapist brick and mortar, you could see them virtually. This one's a little bit faster. It's a little bit more convenient. I can do it from my house, but that's not really going to drive outcomes. And so we have to do the hard work. So what we did is we went to market. Everybody's competing on SLAs, meaning that they're all just competing on how many they have and how long you have to wait and how on demand it is. And we said, no, we're actually going to compete on outcomes. We think we're going to drive outcomes. But to do that, we went to a bunch of the different partners and said, we want to build something new with you. That's really hard, because we're not going to just sell what you have. We have to actually create this collaborative care program, meaning that like our nurses have to like talk every week to your therapist and come up with the shared plan, and we have to exchange data. And a lot of places we went to us and looked at me like I was batshit crazy. And they're like, we're not going to do that. And we were lucky enough to find Ginger willing to do that. But it's really, really hard to do that. And I think that gets back to the concern of how are we not going to become like Optum or whatever? To me, it's because we're selling outcomes. Like that's the other part that's baked into Accolade's models. We have to deliver outcomes and savings. Otherwise, we don't win. And that's the direction we want to go. Because if we don't do that, once you start getting in the fee for service kind of hamster wheel, it's going to be very difficult for us to control that.
Yeah,
so that's how we want to be different, because that becomes the dog that wags the tail. Sorry.
I have a question going back to the book real quick, and I don't know if you addressed this or not because I did not receive a copy of the book. However,
we'll fix that. I got you.
Please do, because I would like to read this. But so care after COVID. And so I love what you said though about the healthcare practitioners and like this being kind of like the greatest generation. And we saw the agility, we saw their ability to like go into parking lots and like, change all these care protocols on the fly. Do you also talk about what happened to the patient? Because I feel like we've all seen a little bit more scrappiness in ourselves as patients. I mean, your own story from the other night, or like people, I know people who were trying to get COVID tests, couldn't get a COVID test here. I'm driving 3 hours to get a COVID test over there. And it's like, people know things like, or even what we were saying, like Gio, when you kicked us off, talking about the number of people who are choosing not to get the vaccine because they're hesitant. I'm making my own healthcare decision. The government, everybody's saying this is the right thing to do. I'm still waiting. So have we seen like maybe, and I don't know, a new side of the patient that needs to be taken into account here? Oh. And do you talk about that side at all in the book?
Totally. And yes, I do. And actually, that's what I was going to say in response to Michael's comment, which I agree. Michael, I know it's going to take time. We've accelerated to where we need to go. We're not even close. But I think patients have changed in such a good way. I mean, think about it. On one level, every single day for the last year, we're reading about health. Like, not like what happened in Hollywood, not like some like other thing. Like, we're reading about health. Like, we've learned about sensitivity and specificity. How many of you guys know what a sensitivity and specificity is now? All of you. How many of you guys know what the FDA approval process is? Like, I've had patients come to my clinic who are janitors be like, Shantanu, like, I'm not happy that they didn't include enough African-Americans in like the phase 3 clinical trial for Moderna. And I'm like, yeah. And he's like, but I'm still getting the vaccine because I want to be on the vac system so that my data gets uploaded so I can be, people like me can get help. I'm like, yes. You know, like we had to, you know, we built a bunch of navigation skills. Like, I've seen our patients get more organized because they couldn't see their regular doctor. So they couldn't just, like, it used to kill me. Like, I love my patients. It used to kill me before the pandemic, right? When a patient walks in, you're like, hey, like, do you know what medicines you're on? No, like, don't you have it there? And you're like, yeah, I do. But like, you should know it too. And now that's changed because they couldn't see me. They had to see other people, and they've gotten better at some of that. So they've built a muscle too, to your point. And I think the question now is, well, what are we going to do with that? And again, that goes back to this moment, right? That they're activated on some level now in a way that I think, Michael, you've been dreaming about for a long time. And then it's like, and now what? And that I do talk about that.
So just so one
cool.
thing I want to,
let me give you another story. My mom, so a big reason I became a doctor is because my mom developed diabetes when I was in middle school, type 2 diabetes, which runs crazy in my family. For 25 years, she didn't have this thing controlled. And it used to hurt my soul as a son and as someone who thinks I'm a good doctor, because I feel like if my own mom can't get this controlled, how am I going to take care of anybody? I mean, it really was deep for me. And during the pandemic, all this stuff about COVID and diabetes, COVID and diabetes, COVID and diabetes, she went online, she signed up for Virta, right? And my mom's been on insulin for the past 10 years, doses going up every 2 years, A1C never controlled. And 2 weeks later, they dropped her insulin from 25 to 10. 3 weeks later, she was off. And my mom's actually hanging out right now in my house. And she's been insulin free, you know, since July now. And she did that because, again, that motivation was there. She navigated herself to it. She got the blue box in the mail and she made some changes. And I'm like, let's take that spark and like, let's keep going. That's where I want to go.
Yeah, I think there's one more star in your book, who is the community nurse in Chicago called Marla, I think, who's also she's going to be on the red carpet on Oscar night. But this is really fascinating, right? Because we all talk about this, and like, you're in a company that's doing this, and Jen, you have to like sell this to the world, and Jess, you and I talk about this stuff all this. How do you scale this stuff? Can you use robots and bots and AI? And you can. But at the end of it, the reason that the bots and the text messages, all the stuff in Chicago worked is because they were all kind of upset that all the patients were worried about upsetting Marla by not like having good scores. And Arnie Milstein's done a lot of work on this, and he basically says that, you know, if you're going to have a high performing healthcare system, you've got to have a relationship where somebody is concerned about what someone on the other end thinks. It's probably not the doctor, it might be. And even, you know, something which I've been looking at for years.
Probably not the doctor. Yeah.
You know, Jeff Green from Med Incentives got a thing where the patient commits to, you know, pay attention to what the doctor says, the doctor admits to, you know, and that there's a bunch of ways it kind of work. And then we just don't have that personalization. I think you can probably deliver that level of personalization with the machine as well. I think that some people in mental health in some areas actually do better talking to bots, and, you know, and there's a bunch of research yet to be done on how does it work. But you've got to have that relationship with somebody. You know, you've got to have somebody who cares about you, and you've got to make you care about yourself. And I don't know if you were that person, you were the bot, Shantanu, for your mother, or she just did it herself, or how she like figured out who Virta was and that there was this thing that was possible. But to me, that's you know, that's patient activation inside itself, but we've got to like scale. How do we scale that so more and more people can figure out, yes, I can change the way I'm working, and I can change the way I'm being a patient, because, you know, as you said in your book, what, 5,000 hours a year where you're not in the doctor's office makes a big difference.
Totally. No, so much I can say. At first is I started thinking about a hip hop line, which is if you're not sharing, people aren't caring. I mean, I think caring, empathetic people and relationships, Jessica knows what I'm talking about. That is central to healthcare. And never thought I'd drop a hip hop line like in the middle of this interview, did you? Like, to surprise you. And I think for my mom, look, a lot of times, like even when I play like Angry Birds or whatever, like it's really addictive. I get into it, but it doesn't sustain me. And so, yes, my mom found this on her own. She was motivated. But the thing that keeps her on the program, and this is really interesting. My mom is from India. She immigrated here when she was 13, couldn't speak English. So she still doesn't, you know, and so for her, the way she describes it to me, because I asked her about it, I said, oh, like Verda, what? Oh, Verda, they're my friends. That's like how my mom describes it. And then but on the back end though, it doesn't mean that every interaction they have with Verda has to be done with a human being, right? Right? Like once you build a relationship, it's like when I text with my wife, like I'm taking our 25-year-long relationship and potentiating it through text messages, right? And that can carry the valence of our relationship in it for certain types of exchanges, right? And it's the same kind of thing. And I think, yeah, I don't think we've scaled that. And that's really the role of technology. That's why I say digitally enabled. What are you enabling? Well, you're enabling human relationships, right? But doing it in a way that scales and frankly meets people where they often want to be met.
Fantastic. I mean, that's a great way for us to end. And we always end health and sorry. Now I have got the COVID. Jess, we did a health and tip this morning, and Jess was giving me crap about being foggy, and I feel fine, but the Pfizer shot has made me more of an idiot, or I was an idiot in the first place, one of the two. We'll figure it out. But we always end the same way. Shantanu, for those people who are listening for the first time, is that we always give a little. We asked you on the way in what you've been noticing. Now we're going to ask you for your forecast for the next couple of weeks, what you expect to happen, and I'm going to start with you, Lygeia.
Yeah, so in my own life, I expect an actual haircut with a proper hairdresser in a salon, and I am thrilled about that. Bigger picture, though, I just wanted to comment on an idea that I was thinking about listening to this conversation. I think there's often a tension between what we would want the ideal health system to be and sort of getting stuff done in the messed up system that we live in. And I think ultimately we have to work both angles at once. And sometimes it's different actors. Policy, government has to be thinking about the big blocks. And if you're in the private sector, particularly if you're a smaller entity, you can only live smaller term. You can't play those big games to the same extent. But I think it's really important to kind of keep both in mind. And I do want to say that even though I don't think an employer-based system is optimal, I think it fits in that bucket of it's making stuff work with the system we have. So I'm not saying like diss it. I'm just saying it's not perfect, but let's do it. So wanted to add that thought.
Jen.
Well, to Shantanu's point that we're all becoming a different type of health consumer over the last year, I think the next several weeks, the next couple of months, we're going to have this weird mixture of we're vaccinated, should we go get the haircut, meals with family, am I thinking about actually going to the office? It's going to be a really interesting new phase of the pandemic and all of the social behaviors that go along with it. And I actually have dinner plans with some friends this week, and that's like really, really exciting. So I think that's going to be fascinating.
I know if I didn't get my invite. Yes.
All right, well, next couple weeks, let's see. Through a panel discussion I was a participant in, it seems like the CMO of Accolade was really hot on Verda, like strangely hot. So I'm going to start some acquisition rumors there, and we'll see what happens with those. Also, I'm going to be watching for...
Not sure they've got enough money. They need to borrow some more from Tiger.
I don't know. We're going to see how that earnings report goes. So I've got my eye on all of our 7 health tech startups that have gone public. We're going to be looking for the.
Oh boy, I'm going to be getting a phone call. Like,
sorry about your luck.
It's all good. I can take it.
I'm going to bring Raj on WTF Health to talk about this. You're in trouble now.
All right.
Anyway, I'm watching for earnings reports. That's what I want to see. Teladoc was terrible today. Well, at least their stock became terrible, even though their revenue was up, but still not as good as it could have been, should have been. And so we'll see what else everybody else has to throw out there here in the next couple of weeks.
All right. Michael. You're on mute. Unmute, please.
Well, for anyone watching this, I thought this panel had amazing real world wisdom that I think is sometimes lacking in big picture discussions. So I think that was terrific. I did have dinner. My wife and I had dinner with friends last Friday night for the first time. It felt really weird. What we're at a point where it remains to be seen whether the pandemic recedes or carrying the Trumpian flag of freedom, we get a remission. If it recedes some, we'll go back to normal health policy arguments over access and all the rest of that. If it doesn't, we'll go back to a Groundhog Day and talking about the pandemic. One of the Democrats, I forget whom, the other day made the suggestion that Trump, who has been vaccinated, should do a public service announcement to get people vaccinated. And I think that's great. And frankly, what I would do, which nobody has suggested to my surprise, is he is on the record on a TV clip saying that he's been vaccinated. You don't need his permission. Why don't they just run it with him saying he's been vaccinated? And I sort of don't understand why nobody's done that, but who knows? So I think we could have some very good days ahead with haircuts and dinners and all the rest, or American individualism could triumph. It kind of depends.
All right. Shantanu, what are you looking for the next couple of weeks?
Yeah. For me, I think, as things get back to normal, right, I want to be able to be out there and still saying that we can't go back to how things were. We're not happy with where things are now either. We have to move forward. And so for me, with my book coming out on Tuesday, I was in the Boston Globe this past week. I'm in the Washington Post next week, doing an event, A New America, have time with all of you. Like, I think this is our collective moment. It doesn't have everything we want, maybe, but this is as big an opportunity as we're going to get to move healthcare forward. And so I'm so thankful for the opportunity to talk to you guys today about that. And that's where I'm going to be out there for. Just, I don't need another job, although maybe Jess, after your comment, maybe I am going to need a new job.
Maybe you will need one.
We'll see if I can join the gang here. But I did this because I really do see this as a moment. I'm deeply passionate about where things need to go. And so really excited to bring you guys along on that journey and for what's coming up next.
Hey, Shantanu, just say that your boss misheard that you said virtual care and she heard Virta care.
All right. Well, so I'm gonna wrap us up with two things. One is to thank all of you for coming on. Thanks, Shantanu, for this is his book, Care After COVID. And now I'm going to tell him the story, which will also be in Health in 2.0 tomorrow, about how I should have been very, very rich. So when Plushcare was just getting going, they were down the street from us. Health 2.0 was actually their first client ever. And Ryan wrote to me and he said, "Hey, can I come and exhibit at your conference?" And I went, "Yeah, it's $5,000 to buy a booth." And he went, "I haven't got $5,000. So I said, "Well, can you give me an IOU?" He said, "I can't do an IOU because I've got so many IOUs already. My board we're concerned about it'll stop us raising our initial round." So he said, "How about I just put the $5,000 on the note, on the safe note?" So he sent me this in an email. And I went back when the acquisition happened to see what I'd last talked to Ryan, and I found this email trail, and I never replied to the email. So answer your emails. It may cost you a shitload of money if you don't. So that's all right. So that is the end of yet another THCB gang. I want to thank my guests as ever. We had today Michael Millenson from Health Quality Advisors. All the way from Chicago. Shall I make this come large? Come on, here we go. Jen Benz from San Francisco, heads up to communications at Siegel Benz. Lygeia Ricciardi at Carium from Washington, D.C., the one without the vote. Jessica DaMassa, these days in Jacksonville, Florida, Queen at WTF Health. And our special guest, Shantanu Nundy, who's the Chief Medical Officer of Accolade and the author of Care After COVID. We will be back. Same bat time, same bat channel next week with a different gang for episode 53, but also at 1 p.m. Pacific, 4 p.m. Eastern. Thanks so much, everyone, for listening.